We're here in Monticello by Asisa, 353 East Broadway. Dr. Zahler, people come from all over the Catskills just to see you. How did he earn that reputation?
Well, hopefully I don't meet anyone. We only meet at Simchas, that's first of all. But you try doing the best for each patient, caring for each patient with a little bit of heart, a little bit of, neshama, do what's best. In each case is different, but we always try, doing the right thing.
Color covered because you earned a name. People come from all over. Everybody knows Stitches, Dr. Zahler. Oh, Shots, Dr. Zahler is the best when it comes to that. The kids love him.
It. Thank you.
So, look at the parking lot over here, Kevin. Now, if there's a big parking lot, it means that inside is also big, and they can accommodate all the people here. Let's check inside and see how big and beautiful Asisa of Monticello is.
So, it is a huge parking lot that we have over here. We always hope that it should be like this, with very few cars. That means we're seeing patients, expeditiously. But on the weekends, on the times where there is a wait or with a lot of patients, there's adequate space for enough cars. And you'll see that the space is just a representation of the place inside. It's a huge facility, beautiful, state of the art. Let's take a look.
Let's check inside. Wow. Look at this room here. What's this room here?
So this is the kids' room, the playroom. As we were saying before, when we as kids we just played with the little square.
The square thing.
Right, still remember that.
That was like the staple at every doctor's office.
Exactly. But we had such a big room over here, we decided to convert this into a kids' room. We have a room over here for mothers who are nursing. Separate bathroom over here.
Look at these games here. So kids probably come just to play here.
Kids, yeah. So secondary visits, the primary visit is for the family to have a day out, a couple hours, give mommy a break, send the father out. Secondary, maybe they have a sore throat, maybe they have a fever, but it's mostly like a daycare here.
Look at this.
Just we have some privacy.
With a bathroom. Nice room there, and you have a bathroom right there. This is for the kids area, and I'm not going to show the waiting area because there are some patients here, but it's a beautiful,
very big waiting area.
Very nice, big, spacious waiting area. Let's jump inside.
Let's take a look.
Rooms. How many rooms do you have? How many exam
we have
rooms?
8 exam rooms.
8 exam rooms.
8 full exam rooms. 8 exam rooms. Everything is very new, clean.
State of the art.
State of the art. It's very it gives a very clean vibe over here. Tons of space, a lot of lighting. If you look at each of the exam rooms, we split them up.
Look at these nice big exam rooms.
So we have obviously all the regular types of stuff that you would find in any urgent care or, primary care office, like rapid strep, rapid flus, COVID, foreign body removals, rashes, infections. But we have some really great stuff here that we started in Williamsburg years ago, and Baruch Hashem, we brought it here now upstate, where we really try managing cases that we can. Obviously, each case is different, but we try doing the best for the patient. And if we could avoid a hospital, we try to. Obviously, if the patient needs a hospital, we will facilitate that and we'll start the care. But we try our best to, if it's safe for a patient to stay home, we do our best to try.
So like what? You give IV here?
So yes, we do. So we have our 2 sides of, really 3 sides of this place. It's like a U. First side is like the medical side. We have the medical patients that come in through here. Mm-hmm. And in this room over here, the bigger room, we do, we have...
let's check out that room.
Okay, let's look over here.
What do you have here?
So here's let's say we do IVs, EKGs.
Oh,
now
wow.
we do...
oxygen.
Yeah, a lot of people can fit in this room. Obviously, if we have someone that's acutely ill, respiratory distress, allergic reaction, something like that, we put them straight into this room.
So it's like the right side, the north.
Yeah, the north side of in Maimonides, if you know what that means. But we have full IV, IV supplies, IV medications, whether it's IV hydration.
What's that?
This is a wireless EKG machine.
Oh wow! So you give EKG here as well.
We do EKGs here. We've had quite a few. Obviously, upstate, it's very there's not many options, and there's really very limited definitive cure. So we have a lot of patients coming with a lot of different medical issues, very complicated things, and we've had, Baruch Hashem, we've been able to assist a lot of patients who had heart attacks that came here.
Really?
Came here. We Plenty of times.
On that mission, you've seen MRIs.
We've had MIs. We had it last year, a chopper job from this office. A father came running with a child. It was a head trauma. Child got choppered and had to bleed.
Wow.
We had...
so it's out of this room right here.
Out of this room, we have,
So you use that oxygen?
We use the oxygen. Obviously, it's a case-by-case basis. If a patient needs a hospital and needs a definitive cure, needs more monitoring or a higher level of cure or more testing, we send them out. We do only if it's safe and it's appropriate. Do we
keep the patient
do it?
here.
But we try as best as possible to do with the yiddish neshama, with our heart and putting our heart and soul in every patient. Just trying to do the best, whatever, for each patient individually.
Wow. Let's jump into the stitches room because,
okay.
I mean, everybody knows Dr. Zoller is stitches. I mean, you're a lot more than that, but you're known for your stitches. Everybody knows.
Thank you. I appreciate that. By the way, upstate, appointment only, please, for stitches, because if you don't want to wait 3 hours because there's 15 cuts behind you, call for an appointment. It just makes it a lot easier for everyone else, for you. I'm sure you don't want to sit here. So that's probably the longest period of waiting is stitches, because we have 10 to 20 a day.
Wow.
On a Motzaei Shabbos, I'll be here until 3, 4 a.m.
No way.
Yeah. So,
wow. Question, does insurance cover stitches?
100%. So we take all New York insurances, Medicaid, Medicare, everything in between. We take many New Jersey insurances as well. And even if someone does not have insurance, we really work with them. It's not, we make it, even for stitches or for other things, we make it inexpensive.
What was the most stitches you ever gave in your life?
I don't know. I tell all the patients, and every patient comes and says, "You remember me?" I said, "Not really. I don't remember what I did this morning." "Oh, you saw me yesterday. You gave me 25 stitches." Or, Baruch Hashem, every day I wake up, it's a new beginning. But
no, but like on a single wound, what was the most stitches you actually put into wounds?
So unfortunately, we have a lot of cases where people go for stitches in other places. Let's say they go to the emergency room somewhere, and we just had recently someone who went to the emergency room, needed to go to an emergency room because they were in a car accident and had trauma. It was a young woman in her early 20s, if I would show you the cut, it looked, the whole forehead, zigzag. There were 8 stitches there. The thing looked like a total disaster. They came to me, it was a Motzaei Shabbos, it was 2 o'clock in the morning. I normally don't do it because we do fresh lacerations. But they spoke to me and they pleaded with me, "Please, can I try helping?" I looked at it, it was very bad. We redid it. Baruch Hashem, we took out the stitches. There must have been 50 stitches in this person's forehead.
Wow.
There was a nose laceration that they didn't even stitch, that needed to be stitched. I took them out. Baruch Hashem, it looks beautiful. I'm just happy that I could help this person. One patient at a time. And for her, obviously it's huge, but Baruch Hashem, I have we're given the ability to help, and that's what we try to do.
Who is this?
This is number 1. This is Dr. Ben.
Dr. Ben in the house.
Dr. Ben Bubley. He's number 1 close friend of mine. I don't know if I should say Talmud. He doesn't like that, but he is. But he's great. We work together always. We work very well together. We've been working together in Williamsburg for almost 5 years already. We deal with acute patients together. We work teamwork, and we do stitches together. We do X-rays together. We see patients together. We're always together on the weekends upstate because Dr. Ben has his office in 13th Avenue and I have mine in Williamsburg. But upstate we come together, and on the weekends we're always here together. From Friday to Sunday, we're always working together. So we work.
That's an amazing thing. You guys are in the community. You're in Williamsburg. You know the community. You're familiar with them, with their needs and all that. That's really great.
Yeah. So I came to Williamsburg. Next year is going to be 10 years. In 10 years. I was looking at the photos from the opening. We were just looking at those photos.
Yeah. So you know Williamsburg.
So I came as a nobody. I didn't know anyone, didn't speak a word of Yiddish. I really don't speak Yiddish now, but I understand most of it. But Baruch Hashem, we've gained the trust of the community. There's a lot of mutual respect that goes into that. You respect others, you gain respect back. Nothing is taken for granted. And Baruch Hashem, we
put in a lot of effort and hours.
Yeah, we put in a lot of work. And really, at the end of the day, the two of us we want to go home knowing that we did the best for each patient, knowing that
It doesn't end there. Like even when we're home,
Obviously, yeah.
You get people phone calling you from the house.
24/7.
Wow.
family members, private people, friends, families, neighbors.
So your phone number's out there.
Phone numbers out there. It is difficult. A lot of times we each need our own secretary because it's
Very busy.
very busy. Everyone needs and wants attention. They're especially upstate. I have a lot of my primary care patients. Ben has a lot of his primary care patients. Patients have complex issues, and where do you go upstate when you have, you can't just spend 2 minutes with a patient and know what's going on. So,
That's amazing. Asisa, people come to Asisa, they know they're getting the doctor who's going to care for them, who they can call after hours, who's there for them, not just, in and out.
Also, the big manner that we have between each other is that we've been able to, patients have been able to trust me and him together, work together.
Wow, that's amazing.
Having
That's amazing, right?
You just want me. That's the relationship we've been able to establish over here.
Okay, so now we're starting on. We have the medical side, which is like the right wing of the facility. Now we have the middle side, which is kind of like the trauma wing.
Trauma.
This is where we do our portable X-rays with the fluoroscopy, low dose radiation. We have lead. Now we have, if you look around the room, literally for everything, whether it's a
boots,
fracture, crutches, ankles, slings, many different types of wrist injuries. Also, what we do here that is very unique to Asisa and to here and to Dr. Ben and I is that we do cast here on site, waterproof casting. If something requires a cast or needs to be molded a certain way, we'll work with an
That's crazy.
orthopedic surgeon.
Do you have an orthopedist here?
So we have a close communication with different orthopedic surgeons, and we'll show them live images and live views of what's going on. If it needs a little movement, needs a little, slight reduction, we'll do it, and they will always follow up with the orthopedist after. But they give us the ability to cast the patients here. It used to be that you had a fracture, you were going down to the city for everything. Now, 90% of the cases of the fractures here that we see, we can cast on.
No need to go to the city,
and they can follow up the next day or in 2 days with the orthopedic surgeon.
It's amazing. So you give the cast here.
We do the cast here, waterproof. We have different
colors.
colors.
It's a real hospital here.
We have different colors: white, black, blue, pink.
So for the girls, you have pink cast. The boys, you have
everything
blue.
Waterproof. It's all covered by insurance. There's no extra added fee for waterproof casting.
That's great. Wow.
We'll remove the cast.
Yes, remove the cast.
So sometimes in the event, let's say a child has an injury that we can't take care of, needs sedation, needs a hospital, needs surgery. So a lot of times we'll send them to the city from here with Hatsala, especially if they're in pain. Give them pain medication. We'll start an IV. We'll give them pain medication, and then what we'll do is we'll follow up with the orthopedic surgeons, and then instead of them dragging to the city in 4 weeks to remove the cast, we'll remove the cast, we'll repeat the images and send it to the orthopedist.
That's great. This is probably the most busiest room here in the Catskills. Lacerations, that's the number one visit over here. So you do stitches right here. So lays down over here.
So this room is quite busy. Fortunately, unfortunately, the parents a lot of times they feel like they're going to pass us. Many times we have multiple patients in this room. We like to have, right? It is like a little MCI, but we obviously the bed is a fully functioning bed. It goes to a tape. It goes to a chair. We keep patients comfortable in here. It's a nice big room, lit up. Again, we do.
Where's the actual stitching?
15 to 20 a day stitches, mostly faces. Cosmetic, best cosmetic outcomes. We have top of the line, top brand of stitches, everything that we use. We don't settle, even though these are, everything is much more expensive. We have, for when it comes to a person, when it's, it's very easy to do when it's money, but if it's your child, you'd want the best. That's what we really try to instill and to give to every patient. Just try, even if it's a small minor thing, you have a little cut and maybe put some glue or maybe put a little steri strip, we always will do the best. It's not about the money. If the patient is going to have a better cosmetic outcome, we're going to do whatever is best. If it needs just 2 stitches, we're going to do 2 stitches. If it needs 50 stitches, we're going to do 50 stitches. If it takes me an hour or it takes me 5 minutes,
Wow.
it's a...
Doctor, I feel you in the showman there. Your heart.
So
what is this?
This is the digital X-ray machine, like they typically have in any radiology place or the ER.
So this is a full ER, like you said.
I didn't say that. Obviously, if a patient needs an ER, we send them to the ER. And, unfortunately, there are a lot of patients upstate with a lot of comorbidities, a lot of things that we can't manage.
But look at this.
We can do our best to at least start the process and see if we can manage the patient safely in an outpatient setting. We have a tech always, get read by radiologists, chest x-rays, things like that we'll do in here.
That's crazy.
But we'll try most times to use the fluoroscopy because it's low dose radiation.
Nice. Doctor, thank you so much for showing me this gorgeous state-of-the-art Asisa of Monticello. I'm not going to call it Asisa Monticello because it's Asisa of the Catskills because people come here from far and near just to see Dr. Effie, Dr. Zahler. Gorgeous location, 8 exam rooms plus stitches, x-rays, IV, oxygen, EKG, and anything you might need. I call it a mini ER with the Yiddish hearts with Dr. Zahler over here. You didn't say it, I said it. Kevin, the address is 353 East Broadway. What's the phone number?
845-419-1000. We're open Sunday through Thursday from 9 a.m. to midnight.
Friday is probably...
Friday is 9 to 4.
Motzaei Shabbos?
And Motzaei Shabbos is after Shabbos till whenever. I mean, till the last laceration leaves. Obviously, that's what I'm spending most of my time doing is stitching. So if it needs to be till 3, 4 a.m., that's what we need to do.
Thank you so much, doctor.
So, the brand, it's Asisa to your health. We really try to instill here in everyone, whether it's the physicians, the staff, or the mid-levels. Everyone should, care about the patient. You're not just another number. You're not just, another billing for the insurance. Really try to care for every patient, give that level of heart, and that's really the takeaway from Asisa.
Thank you, doctor. Asisa to your health.